Thank you very much to be here today in this session dedicated to the Mediterranean Alzheimer Alliance. First of all, I would like to thank Alzheimer Europe for giving us the opportunity to offer a full session on the Mediterranean here in Malta. So my name is Federico Palermiti. I'm project manager for AMPA, the Monegasque Association for Research on Alzheimer's Disease, chaired by Catherine Pastor, and his vice president, Professor Alain Pes. And I'm very glad to say that since 2 days we are now member of Alzheimer Europe. So it's really a pleasure to be here. So this session will be chaired by Professor Najib Kinsani from Morocco, and many thanks, Najib, to be here with us. And he's the vice president of Association Espoir Maroc Alzheimer, the Alzheimer Association of Morocco, but he will explain how Alzheimer Association works in Morocco, and Charles Kerry will be joining us in a few minutes. So there will be 4 presentations this morning, which will enable, I hope, you to understand our work across the Mediterranean. I will start by presenting you the development and the ambitions of the islands. Najib will then explain what he have already accomplished in Marrakesh during our workshop last April. And then we will have 2 presentations. The first one is regarding elderly migrants with dementia and the impact of socio-cultural factors on the care. Professor Anne-Marie Duguet from the University of Toulouse in France has kindly agreed to present a study which is carrying out at the moment. And the last presentation will be given by Professor Magda Tsolaki, who all know. She is the president of the Greek Alzheimer Association, and she will be telling us about non-pharmacological intervention. So, I will start. If Najib, you are okay. First of all, I would like to give you some context. We know that the significant increase in the number of people with dementia worldwide is alarming. You all know these figures. And you also know that this increase is mainly, I don't know if it works, yeah? You also know that this increase is mainly due to the increase in the number of people with dementia in low and middle income countries. So why a Mediterranean network of Alzheimer's disease? We all know that countries outlining the Mediterranean are united by historical, geographical, and cultural links, but more importantly, by common values of solidarity. And there is still little knowledge about medical and social problems surrounding Alzheimer's disease, which remains underestimated and insufficiently, sorry, it's a little bit difficult for me this morning to speak in English, documented, especially in North Africa. So we think that by observing and understanding the current measures, as well as the issue for the future, we will be able to identify, to insight, and maybe organize adapted and common solutions for care research and public policy in the region. In 2011, AMPA has organized a first workshop in Monaco and bringing together some Alzheimer association. Okay, thank you. Yeah, thank you. And all the participants during these first workshops agreed that our connection are enough strong to encourage us to work together. So here you are the members of this alliance. So in red, you have the initial members. In blue, sorry, you have the new member who will join us tomorrow in our workshop. And in blue, you have the members that thanks Tunisia and thanks Morocco, maybe we will have them next year, we hope. So the idea that this network, and it's only a network, will bring together not only Alzheimer Association, but also scientific and professional caregivers representing each country, so that all medical, social, and social aspects can be tackled. In April, we were in Marrakesh, thanks to the efforts to Najib to organize a nice scientific congress, and all the 9 associations who were there have signed a charter, and you have here the 7 points and the objectives of this alliance. So the first one is to create a Mediterranean network. The second one is to improve and increase knowledge, and I will explain what we are doing. To promote and diffuse also local experience. I'm thinking about Tunisia or Morocco. I was very impressed by I don't know the word in English exactly, but the caravan Alzheimer who goes in the campaign, and it was really, really interesting. And I think that this kind of initiatives needs to be known by all the people. And we also would like to suggest recommendation in order to act on a local and international level. We will try to extend the network to other research teams. That's why Anne-Marie Duguay is here. She has an association in law and ethics in Europe, and she is very interested in cultural issues. And we would like to encourage scientific and associative partnership, and we have to think about it. And also, but we know that it will be complicated, but we will try to manage it, to develop training for professionals, for example, in Morocco. So, concerning the next step, our first ambition is to try to write up an update of the needs and the Alzheimer situation in each country. This report will be published next year, and we will present a government recommendation in order to be sure that Alzheimer's disease will be a priority in policies in the Mediterranean. And I am pleased to say that the Union for the Mediterranean seems very, very, very interested in our project, and I have a meeting in December in Barcelona to explain what we are doing and to imagine how the Union could help us. We also would like to develop expertise in different topics which have not been really developed until now. The first now, it's all issue concerning Mediterranean family solidarity. We are sure that there is a gap between preconceived ideas and reality in these countries. So we really need to learn more about your culture. And that will be one of the first topics we would like to study. The second one, and Marie is here, we would like to study or to better understand the issue concerning the elderly migrants. Another topic is social and cultural representation of dementia in this country. And of course, Mada will explain us non-pharmacological intervention. Other projects will be discussed tomorrow morning, one of which is an internet website with an exchange platform. The organization of our next workshop, and we will maybe have a surprise tomorrow. But also, and it will be a little bit complicated, but we have to imagine how to implement it now. More long-term projects, academic and scientific collaboration. Najib maybe can explain it, but he has a partnership with France and the University of Toulouse, and also training for professionals in North Africa. This were a panorama of our alliance, and maybe Najib, you will start with one, the situation in Morocco, and what are you doing now, and what was the impact of the alliance in your congress. So thank you very much, and if in the room, if we have other Mediterranean actors, don't hesitate to come after the session in order to participate to this nice project. Thank you very much.